Good morning. I'm Deb Lubar, Director of CDC's Office of Policy Performance and Evaluation. I'm pleased to serve as your moderator today, and I want to thank you for joining us for our conversation about the updated respiratory virus guidance. Joining me today are Dr. Nirav Shah, Principal Deputy Director for the CDC, and Dr. Dimitri Daskalakis, Director of CDC's National Center for Immunization and Respiratory Diseases. Our panel will discuss updated recommendations for how people can protect themselves and their communities from respiratory viruses, including COVID-19. Before we get started, I have a few housekeeping notes. First, closed captioning is available by turning on the captions in your YouTube player. Also, at the end of today's presentations, you'll have an opportunity to ask questions. To submit your questions, please send an email to broadcast@cdc.gov. We anticipate having a large number of questions, and we will try and answer as many as possible during the live event today. To begin today's program, I would like to turn it over to Dr. Shah for some opening remarks.
Great. Thanks, Deb. And good morning, everyone. CDC has updated our respiratory viral illness guidance to streamline advice to people on how they can best protect themselves and others from severe illnesses that are caused by common respiratory viruses like COVID-19, flu, and RSV. Our goal is to continue to protect those who are the most at risk for severe illness, while also ensuring we have recommendations that are simple, clear, easy to follow, and easy to understand. Why is CDC making these changes? The reason we're doing so is because we are in a different place, both in the level of protection people have against these illnesses, as well as the tools that we have available. Simply put, we have effective immunizations against all three viruses, effective treatments for COVID-19 and the flu, and we have more information and tools than ever before on ways to reduce the spread of all three viruses. Now, looking at the data from the most recent fall and winter respiratory virus season, we saw decreases in COVID hospitalizations and deaths, particularly compared to past winter seasons. For example, weekly hospital admissions for COVID-19 have decreased by more than 75%. And deaths have decreased more than 90% compared to January of 2022. And importantly, among those who were hospitalized, over 95% had not received an updated COVID-19 vaccine this season. Now, these decreases came even as levels of COVID-19 spread were similar to prior years. Now, it's important to keep in mind that even though hospitalizations and deaths were lower, they were not zero. The new updated respiratory virus guidance reflects the progress that we've made in protecting against severe illness from COVID-19. Simply put, the COVID-19 landscape has changed, but we must still use the tools that work, particularly to protect against these respiratory viruses. CDC's updated guidance emphasizes core prevention strategies to protect against severe illness from respiratory viruses. Most importantly, stay up to date with the vaccines that we now have for not just COVID and flu, but also this past season for RSV. Second, to practice good hygiene, for example, covering up coughs and sneezes, like washing your hands and cleaning frequently touched surfaces. And third, to take steps to improve air quality. For example, by improving ventilation, by opening a window, or where possible, gathering outdoors. Now, these updated guidance and guidelines streamline and simplify what people should do if they become sick with any of these viruses. CDC's central recommendation is simple. When you get sick, please stay home and away from others. Doing so is critical for reducing the spread of illness and protecting others. Please seek health care right away for testing or treatment, particularly if you have a respiratory virus and particularly if you have severe risk factors for disease. One question here is when you can return to normal activities. And the bottom line is that you can return to those normal activities when, for at least 24 hours, your symptoms are improving overall and your fever has been gone without using fever-reducing medication. Now, additionally, when you are returning to these normal activities, use precautionary strategies for 5 days. These include limiting close contact with others, improving ventilation, masking, and/or testing, all of which can curb disease spread. When you get sick with symptoms like coughing or a sore throat or a stuffy nose or fever, please, once again, stay home. Now, CDC recognizes that there are certain groups of people who are at higher risk for severe disease from these viruses. Those groups were top of mind for us as we were crafting these updated guidelines. We have included in the guidelines additional guidance for older adults, people who are immunocompromised, individuals within the disability community, pregnant women, as well as young children, so that we can continue to protect the most vulnerable, as well as having simplified guidance for all of us. To continue this discussion, I'd like to now turn it over to my colleague, Dr. Daskalakis from CDC's National Center for Immunization and Respiratory Diseases.
Thank you, Dr. Shah. Good morning, and again, thanks to everyone for joining us today. My name is Dimitri Daskalakis, and I am the director of the National Center for Immunization and Respiratory Diseases here at CDC. So today, I'm excited to share our new respiratory virus guidance. I will cover our goals in developing guidance, the changing reality that has brought us to this point, and the guidance itself. We'll then take time to answer your questions. As we have continued to evaluate our guidance, we developed updated guidance that reflects our current reality with respiratory disease and builds upon effective strategies so that more people take action to prevent these diseases. We developed guidance that provides practical recommendations that are clear and actionable. Guidance that's streamlined across common respiratory virus illnesses. Guidance that highlights strategies that effectively reduce risk, and guidance that balances current post-emergency risks with other societal needs. To be clear, this is community guidance. Other guidance for healthcare settings, including long-term care facilities, is available for flu, COVID-19, and other respiratory viruses. We are in a different place than we were 4 years ago. The threat of COVID-19 has changed due to a few key drivers. First, we have effective vaccines and treatments for COVID-19. Both of these cut the risk of severe disease by half, and we'll talk more about that in a moment. We know that the U.S. population now has evidence of broad immunity to COVID-19, with over 98% of people having at least some protective immunity, either from vaccination, prior infection, or from both. But to be clear, it is important that we maximize this immunity by renewing our subscription and staying up to date with immunizations that keep that immunity strong. And we also have other effective tools in the management of COVID-19, including masks, hygiene, and by that I mean covering coughs and washing hands, steps for cleaner air, and access to tests. Together, these changes in the COVID-19 landscape have resulted in fewer hospitalizations and deaths. Weekly hospital admissions have decreased by more than 75% from the peak in January 2022 and are now more similar and are in range with influenza. While COVID-19 was the third leading cause of death in 2021, it's dropped to 10th in 2023. And finally, we're seeing fewer cases of other complications. For example, cases of multisystem inflammatory syndrome in children and long COVID have also decreased. As COVID starts to resemble other respiratory infections in numbers of hospitalizations and deaths, we have also considered important ways in which COVID-19 and viruses like the flu are different, including long COVID and, of course, the toll it takes on communities at increased risk of severe disease. That makes it even more important that we have clear, simple guidance that more people understand and can follow to improve all the complications of respiratory disease. Reductions in COVID-19 associated hospitalizations over time could be even greater if more people, especially those at greater risk, received an updated COVID-19 vaccine. That's why vaccination continues to be one of the core strategies in the updated guidance. Among adults with COVID-19 associated hospitalizations during the very recent history, October to November 2023, over 95% had not received an updated 2023-2024 COVID-19 vaccine. And in fact, most, 70%, had also not received an updated vaccine from previous years. COVID-19 vaccine provides significant protection against severe outcomes of infection. But the bottom line is, too few people have gotten this important immunization. This slide depicts the broad immunity the U.S. population now has. On the left, you can see where we were in January 2021, when vaccine had only begun to be available for certain populations. At that point in time, most people in the U.S. did not have any antibodies, and those antibodies represent some level of immunity. The figure on the right shows over 98% of the U.S. population having at least some protective immunity by mid-2023, with most people having protection from both vaccination and prior infection. But as I said, COVID-19 protection by our immune system is a subscription that we have to renew by making sure that we are up to date with our recommended vaccines so that we keep that immunity really strong. Here we have another visual depicting how the threat of COVID-19 has changed. The orange line shows COVID-19 test positivity beginning all the way back in January of 2020 through this past month. As you can see, COVID-19 test positivity has remained elevated throughout the past 4 years. We also saw very similar trends in wastewater COVID activity, indicating that the virus that causes COVID-19 has been circulating at levels comparable to previous years. The blue bars that you see on this graph reflect weekly deaths attributable to COVID-19, and you can see that they have decreased dramatically despite those comparable high levels of circulating virus. CDC's respiratory virus guidance provides practical recommendations and information to help people lower health risks posed by a range of common respiratory viral illnesses. It includes core and additional prevention strategies. Important to remember, the updated guidance goes beyond just COVID-19 and applies to flu, RSV, and other respiratory illnesses. You know what that means is that you don't need to know what respiratory illness you have to follow the guidance. If you have a fever or symptoms, stay home and away from other people until you're getting better. It is as simple as that. The guidance includes 5 core prevention strategies, which are steps you can take to protect yourselves and others from respiratory viruses. The first is immunizations. Staying up to date with vaccinations is the best way to protect yourself from serious illness. And this is also a great opportunity to point out that CDC now recommends that people ages 65 years and older get another 2023-24 updated COVID-19 vaccine, and that it's not too late to get your flu shot or your updated COVID-19 shot if you haven't gotten it yet. Now, the second core strategy is hygiene. Examples are washing your hands or sanitizing them if you don't have soap and water. And then the things that we've learned during the pandemic, cover your coughs and sneezes. The next core step is taking steps for cleaner air. You can do that in a lot of different ways. You can open a window, you can use air purifiers, or you can decide to gather outside to increase the amount of fresh air that you're around. Now, if you do get sick, treatment is really important. Seek treatment if you have risk factors for severe illness. This may require a test, but I'll talk more about testing in a moment. If you do get sick, the other important core strategy is, as Dr. Shah said, stay home and away from others to prevent spread to other people. Now, how long do you stay home? So we know that everyone is different, and the length of time that they may need to stay home is different too. You can go back to normal activities when for at least 24 hours, both of the following things are true. 1, your symptoms are getting better overall, and 2, you've been fever-free for at least 24 hours and are not using any fever-reducing medications to do so. At this point, you can resume normal activities, but we're encouraging you to take precautions for the next 5 days, such as taking even more steps for cleaner air, being extra diligent about good hygiene, wearing a mask, physical distancing, or testing when you'll be around people indoors so that you can really avoid the spread of the virus to other people. So as I just mentioned, there are a few additional prevention strategies you can choose to further protect yourself and others at any time, but especially in the 5 days after you're able to leave home, after you're feeling improvement in your symptoms or being fever-free for those 24 hours. Now, these strategies sound familiar to all of us. They include wearing a mask with a good fit, keeping a physical distance from other people, or avoiding crowded areas where you may be unable to maintain that physical distance, and then also testing to help you decide what to do next, like getting treatment if you're sick or taking other steps to lower the chance of spreading the virus to other people. Both the core and additional prevention strategies can be especially important in a couple of scenarios. One is, if respiratory viruses are causing a lot of illness in your community, it's a good time to use these strategies. 2, you or the people around you were recently exposed to a respiratory virus, are sick, or that you're recovering from one. 3, you or other people around you have risk factors for severe illness, including older adults, younger children, people who are pregnant, people whose immune systems are weakened, and people with disabilities. Remember, you may not always be aware of the things that can make other people more vulnerable to serious illness. These 5 core prevention strategies can provide a degree of protection no matter what. If you are unsure about the health condition or risk status of people around you, you can protect them by choosing to use these additional prevention strategies that we've talked about. I want to take a minute to reiterate our guidance for when you have a respiratory virus symptom that really isn't better explained by another cause like seasonal allergies. Remember, step 1, stay home and away from others. When for 24 hours, both your symptoms are improving overall, and if you had a fever, that fever has gone away without fever-reducing medicines. If all of that is true, you can move to step 2. Step 2 means resuming normal activities, but enhance those precautions for the next 5 days. And just as a reminder, the precautions include taking additional steps for cleaner air and/or hygiene, masks, physical distancing, and/or testing when you're going to be around other people indoors. What should you do if you test positive for a respiratory virus but don't have symptoms? Well, the answer is use those additional precautions we've talked about for the next 5 days after that positive test. Before we conclude, I wanted to take some time to share that we also have a number of special consideration pages in the updated guidance for people with certain risk factors for severe illness. That includes older adults, young children, people with weakened immune systems, pregnant persons, and people with disabilities. These pages include an overview of the population and risk, why prevention is important, and how these populations can make plans for protection. I want to wrap up by saying thank you. The past 4 years have been filled with ups and downs, successes and setbacks. Your partnership as we have navigated through the pandemic and beyond has been critical, and we are incredibly appreciative of every one of you. We're now in a new place with COVID-19 and other respiratory diseases. We are excited to move forward with this new simplified respiratory virus guidance that reflects this new place. I would like to now turn the program back over to our moderator, Deb Lubar.
Thanks, Dimitri. Our first question is about healthcare settings. The question is, will COVID guidance for healthcare settings be changed and updated? And what about long-term care facilities?
Thank you for that question. So there is current guidance for COVID-19, flu, and other respiratory viruses in healthcare settings. As always, we're evaluating and reevaluating our guidance, but there's no change in that guidance at this time. Important to note that long-term care facilities are included among healthcare facilities. Thank you so much for that question.
Thank you. Can you say more about what this means for flu or other respiratory viruses? Has the guidance for what to do when you have the flu changed?
So the core of what to do when you've got the flu is found in these updated guidances, which is to say, please make sure you are staying home when you get sick, stay indoors until your symptoms are resolving, and you're fever-free. And then, of course, you can go back out after that time period. What is different here, though, is the recommendation to use these additional precautions after your symptoms have improved and your fever has come down. Whether that's wearing a mask, whether that's making sure you're maintaining distance, whether that's improving the ventilation around you, those are new additions when it comes to things like the flu and RSV. The core remains the same, staying home when you get sick. But the addition of these other precautionary measures is something that is new and was something we believe will further enhance protection as folks are resolving from any of these 3 respiratory viruses.
Thank you for that. What's recommended for people who know they were exposed?
Thank you for that question. The core and additional precautions are ones that people can take at any time. There's no specific guidance around what happens after an exposure for lots of reasons. One is it's really hard to figure out if one exposure is higher risk for transmission than another, since these viruses, when they are circulating, tend to circulate pretty widely in the community. The other important point is that the core strategies for preventing these viruses can be dialed up and dialed down, and the additional strategies can be dialed up and dialed down. So if someone wants to take more effort with hygiene, wants to take more effort with improving ventilation, decides that they want to wear a mask, do physical distancing, all of those are possible. And of course, testing is also on that list. So rather than specific guidance around an exposure, it's really about having all the tools in the toolkit to be able to optimize the situation given our changing reality with these respiratory viruses. Thanks again for that question.
Thank you. So guidance is just one part of the picture. What else is CDC doing related to respiratory viruses?
That's a great question, because the question is exactly right. Guidance is just one piece of the puzzle when it comes to successfully controlling and reducing the overall burden of respiratory viruses. Guidance is an important piece, make no mistake, because each of us has a role to play in keeping our communities safe. And as the guidance suggests, when all of us in every single community, in every single corner of the country are using this guidance, then the rest of us, all of the rest of us benefit as well. But it's not guidance alone. CDC is doing a few other things. The first is maintaining our monitoring for when respiratory viruses are peaking or reducing. And we do that through a lot of different ways. For example, we have a robust wastewater surveillance program that works with state health departments around the country to track the rates of assortments of respiratory viruses as they rise and fall throughout the season. We're also in very, very close contact with healthcare providers, so we can get a sense of when more people are coming into the emergency department with signs and symptoms of a respiratory virus. And when that does happen, we're able to work with providers as well as hospital systems to get them the resources they need to reduce those risks. And then we're also making sure that everyone in the country is equipped with the best information and tools. For example, our colleagues elsewhere in the U.S. government have continued to make rapid tests available. You can get them online at covidtest.gov, and the U.S. Postal Service will mail you rapid tests straight to your front door. We've also worked with pharmacies and other providers earlier in the season to make sure that vaccines were available to every single person in every community in every corner of the country. Respiratory virus control isn't just about guidance, it's all bets on the table. So we're taking every single strategy and using it so we can at a community level reduce our risk.
Thank you. What if the virus changes and a really bad variant happens? Would that change CDC's approach to this guidance?
So I'll start by saying, I think we're focused on COVID, but this can also happen with flu. And it's something that we do really every year, really monitoring carefully, as Dr. Shah said, what's happening with the genetics of the viruses, like what strains are circulating. But ultimately, the answer is, if we're met with a new challenge, we're able to change the guidance to sort of to reach what we need to reach. Bottom line, though, is that most of the core as well as the additional strategies for prevention are going to be key for all respiratory viruses. But we always respond to whatever nature hands our way. So I think we would obviously reevaluate the guidance if we need to and make any tweaks or additions as necessary. Thanks for that question.
Thank you. So what are the data saying about long COVID? You mentioned this in your remarks, Dimitri, and how can people protect themselves from getting it?
So what we are seeing in the data is that vaccination is critical in preventing long COVID. So really, I think that's number one and the most important step. So as we're seeing changes in long COVID over time, both domestically and internationally, we're seeing less of it, but that doesn't mean that it's not serious. We really need to emphasize that COVID is different than some of the other viruses, and in so doing, creating guidance along with vaccination, really focused on the strategies that people can use every day to prevent severe disease, really is a gateway toward improving outcomes in long COVID. Thanks for that question.
So can you talk a little bit more about steps to cleaner air? What does that mean practically for people, and how do organizations fit in, institutions?
Great, thanks, Deb. I like the way you divided that between what people can do and then what larger organizations can do. So one of the things that we have a much finer appreciation of and a lot more data around now since COVID is the importance of clean air throughout our buildings. And you can think about clean air in two different ways. You can think about increasing ventilation, and you can think about increasing circulation. Let's talk about ventilation. Ventilation is the exchange of air from the outside into the inside and vice versa. And you can do that through a number of different ways. The simplest of which is opening a window. Opening a window allows outside air to come in and vice versa. And as a result of that, the viral particles that people might have are spirited outside, thus making the indoor space safer for everyone. Likewise, circulation is the other part of clean air. And circulation involves moving air around, usually through a filter, to reduce the number of viruses that are circulating. Both of them are key, and thankfully both of them for individuals can be easily implemented. I already mentioned one of the easiest ways already, and that's simply opening up a window, particularly if you're at a gathering where there are more vulnerable people there. An even easier way, where available, is to move gatherings outside, because that's maximum ventilation and maximum circulation. Institutions and organizations have a role to play as well, whether that's building managers or schools. And there, they work with very sophisticated groups like engineers to use systems that circulate the air over a course of hours to make sure it's fresh, to make sure it's clean, to make sure that those who are indoors have the availability of the cleanest air possible. But for those of us at an individual level, doing things like gathering outside where possible, opening windows, and if needed, to purchase high-quality filtration, all of those steps, when taken together, can improve the air quality for all of us.
Thank you. So does this new guidance just cover COVID, flu, and RSV? What about the common cold and other respiratory diseases?
So this is respiratory virus guidance. So very intentionally, it's meant to cover all of those respiratory viruses and more. So if people are experiencing respiratory symptoms, the simple guidance is stay home until those symptoms are better. And if you have a fever, that fever has resolved without fever-reducing agents for at least 24 hours. So short answer, it's really for all respiratory viruses and also covers other sort of syndromes that could cause respiratory illness.
So we've gotten this question a lot. How long do people typically shed virus and spread it to others for COVID and for flu?
Sure. So everyone is different. So that's probably the most important first answer. And so generally for COVID-19, most people after their first positive test or their symptoms begin tend to clear within 5 to 7 days. That means that there are some people who could be shedding after those 5 to 7 days, which is why in this new guidance, we have this really important phase of 5 additional days after you leave your home and go back to normal activities to make sure that you do take efforts to enhance prevention, whether that's fresh air, whether that's hand hygiene, whether that's testing. All of those go together to be able to cover and sync as close as possible to times when we see higher levels of viral shedding with prevention strategies that prevent transmission.
Well, that was all we had time for. Thank you, Dr. Shah and Dr. Daskalakis, for joining us today to discuss the updated respiratory virus guidance. If you'd like more information on the health topics and activities discussed today, you're always welcome to email us at media@cdc.gov. And be sure to follow CDC social media for the latest updates and news. Thank you so much for joining us today.